last resort, and it's about a class of antibiotic-resistant bacteria called carbapenem-resistant enterobacterianism, called CRE. That is a major issue in the healthcare. CRE cause bladder, lung, and blood infection that will turn into life-threatening infection. They evade the action of almost all antibiotics, including the carbapenems, which are considered the most effective drug. An analyst in the United Kingdom predicts that if antibiotics become ineffective, everyday operations such as hip replacement could end in death as many as 1 in 6. Antibiotics have been falling into resistance for almost as long as people have been using them. Alexander Fleming, who discovered penicillin, warned about this possibility when he accepted a Nobel Prize in 1945. Knowing this, doctors have used the most effective drugs sparingly. Researchers thought carefully use would keep the remaining last resort drugs, such as carbapenems, effective for decades. Alexander Callan says it's not too late to intervene and prevent these from becoming more common. At the same time, he acknowledged that in many places, CRE are here for good. One of the reasons why the resistant strain spread so rapidly was that they were difficult to detect. Most clinical microbiology labs no longer grow culture bacteria over days to determine which drug they're vulnerable to. Instead, automatic systems can give a result in hours. But these tests are giving misleading results and were causing doctors to give patient doses or drugs that would not work. Such a rapid distribution hinted that CRE were traveling from person to person rather than erasing it independently in each location. This made sense because many enterobacteria, including Klebsiella, live in intestines and can easily be carried by a patient. If a patient develops diarrhea, the bacteria can spread all over the hospital. The bacteria spread rapidly. In 2007, there were over 1,000 cases nationwide. Countries like United States and Israel are affected. Israel thought they had found a cure, but the enzyme had moved over to Italy, Colombia, the United Kingdom, and beyond. In 2008, there were a patient in Sweden who got infected. Most individuals carrying the bacteria with the new resistant factor had some links to clinical in India. Through health care needed while they were abroad. Therefore, doctors named the new enzyme New Delhi. They found the bacteria carrying the enzyme were present in water in South Asia. The problem was not only had another resistant bacteria emerge, but the CRE were now flourishing beyond hospital walls. Researchers were still struggling to pin down exactly how the bacteria were spread. A hospital in Colorado discovered that they had 8 patients with that bacteria. There were no obvious pattern. The patient had been in the hospital for a long time. The data could not explain how the bacterium had spread. There were hypotheses that hospital had a ghost patient, someone who spread the bacteria. Once the hospital became aware of the cluster, no further spread occurred. Researchers have already spotted the carbapenem-resistant bacteria in the United States and South Europe. They say they have learned major lessons from CRE. Drug-resistant bacteria can emerge and spread much faster than the past public health surveillance system. Some countries are trying to take those lessons on board. Israel practices active surveillance, meaning that if a new patient has been to another hospital the past 6 months, they're checked for CRE. If anyone's test is positive, they are flagged as a carrier. France and the United Kingdom follow similar rules, but unfortunately many countries do not. It seems unlikely that new drugs will become available soon, provided the rapid advance of resistance and the consequence to use these drugs really has convinced companies that antibiotics are not worth the investment. Expert means that their best tool is hand washing and the use of gloves and gowns and aggressive environmental cleaning. It's so fun.
Sure, I can go next. I've read the article about India moves to tackle antibiotic resistance which is about how the government in India is tackling the issue with antibiotic resistance. And antibiotic resistance is a problem in India, a huge problem, and it has become a problem because it's because the hospital standards are quite inconsistent in India, and also because there's a huge misuse of antibiotics in the country. And there is also the reason that it is a big misuse of it is because it's a huge market for over-the-counter sales of antibiotic in the pharmacies, and people in rural rural areas, well, they don't trust the hospitals, so they go to pharmacies to buy antibiotic without any prescription, and that leads to, well, if you have been exposed to the drug before, and then if you have been exposed to the drug, the risk of developing a resistance, your body developing a resistance is 15 times greater. So it becomes a problem quite for many. The government are trying to tighten the regulations for the sale of antibiotics. So they are putting these red labels on the bottles, so that inspections in pharmacies could they can control if they're doing over-the-counter sales in the pharmacies. That's probably not the only thing they're doing. That's not working very well. And I also had this other article about antibiotic resistance shows up in India's drinking water, but I found that article quite difficult. So, it's mainly about that they found this gene in the water that's it is carrying the resistant bacteria. So people will get exposed to it, by the drinking water. Yeah, that's me.
Okay. I had an article about MRSA, which stands for Penicillin-resistant Staphylococcus aureus, which is forming up trouble. And microbiologists are trying to work out whether the use of antibiotics on farms is fueling the human epidemic of drug-resistant bacteria. Up until now, there has been no case of pigs carrying anything about the MRSA in the US, only in Europe. But the first time they discovered it was on a farm in the US in 2007. And if pigs were infected with this, their belly button will turn like being outy instead of an innie, so he says in the article, and that will cause the belly button to be inflamed, and will cause easy entry for bacterial infections. And MRSA has troubled hospitals around the world for more than 4 decades, but hasn't been infecting people outside of the healthcare before 1995. It causes around 150,000 infections and 18,000 deaths annually in the US in the latest year now. And in Europe, it caused more than 200,000 people infections for the people. In the first appearance on a US farm, it signaled the expansion of what many believe is a dangerous source of human infection. Scientists and health experts fear that it is the drug-resistant bacteria from farms are escaping via farm workers or via meat. And last year the US Food and Drug Administration recommended more restraint in the use of antibiotics in the livestock, following the lead of regulatory authorities in other countries. But the meat and agricultural industries are fighting those restrictions. They claim that MRSA and other drug-resistant bacteria that cause human infections arise in hospitals, and that meat production includes safety measures such as sanitation rules in slaughterhouses that prevent resistant bacteria from spreading to and infecting people. But the major problem in this is the lack of data, because many farmers are reluctant to allow scientists access their facilities. And the farm workers, many of them are undocumented immigrants, and they are very wary of anyone who might want to sample them. But this researcher called Smith are starting to fill the void now. They have really found that anyone who is concerned that the farmers are still overusing antibiotics will hope that the result of the current research will sway their opinions, because antibiotics on farms can trigger the emergence of restrained strains, and those strains turn up on meat and in grocery stores and in homes, and they can infect people. But at the same time, Smith sympathizes with the farmers who are trying to produce meat as safely and efficiently as possible. And although the human health should take priority over farm animals, farmers would be reluctant to change until researchers can come up with safe and cost-effective practices to replace the use of antibiotics.
Okay.
It's 11:26, so we can, I'm sure, discuss.
Okay.
I don't know where to start. Well, it's a big problem.
Yeah, it is.
Obviously. Both in like the developed countries and also like
In India.
in India,
Yeah.
countries like that.
Yeah.
No problem there.
And I think the problem is that they don't have that much money. The economics are not. It's not working that well.
Yeah.
And so.
Well, that is the problem. They have the money,
Yeah.
but at the same time, they said in my article that if they don't do anything, it will be an even greater cost.
Yeah.
They have a problem.
Exactly.
It's a temporary solution to use antibiotics.
Yeah, it is,
Yeah,
and now we have used
eventually
it
will
too
stop
much. Yeah.
working. Yeah. And
But like, how is there a solution for it?
I think we need to find a new cure that will work.
Yeah.
And that will cost a lot of money, but at the same time, like developed countries would have to put those money to save
Yeah.
And to
spreading
save
the
lives.
to save spreading the disease.
Because right now they have nothing like better to use. Actually, it says here that we're kind of stumped with doing
Yeah.
anything to do
Yeah.
right now.
Because I mean, they should stop using the antibiotics, but
But at the same time,
at the same time, that's